All right, so welcome everyone to our very first information session for the Master of Science in Health and the Public Interest for our next cohort, the cohort of 2026. We're really excited to have you here as we're kicking off to the school year, and we've already really seen our current cohort come together. So we're very excited to kind of feature them more on our socials, maybe even in some of these information sessions as we get later into the year and see how our future class kind of adds to the happy community. So I'll get us started. So here's what today is going to look like over this hour. We'll introduce ourselves, of course, everyone on the call, their roles within the program. We'll talk about the program itself, what makes Happy different than other public health and MPH degrees. Talk about career opportunities and alumni outcomes. And I'll go over the admissions overview, what to expect when applying, and how to finance your degree. And finally, we will, of course, leave plenty of time for all of your questions. So first, I'll introduce kind of the main program staff, and then we'll turn over to the faculty, including our special guest, Dr. Lynette Golding, who is here with us today. First of all, my name is Jennifer Jansen, or Jenny Jansen. I use she, her pronouns, and I am the program coordinator for the MS Health in the Public Interest, or HAPPY program. What that means is I support graduate students from application to graduation in the program, from recruitment and admission support to academic advising to other various programmatic needs. So I'm a great resource for questions about the program and application logistics in particular. But feel free to shoot me a message if there's anything where you kind of don't know the right person to reach out to in the program, and I can help you out with that. I will pass it over to Dr. Fu Berman, our program co-director, to introduce herself and talk a little bit about our co-director, Dr. Adam Myers, who will not be with us today as he's out on vacation.
Hi, I'm Adrienne Fu Berman. I'm trained as a physician. I'm in the Department of Pharmacology and Physiology and also Family Medicine at Georgetown. And I'm founding co-director of the HAPPY program, Health in the Public Interest, along with Dr. Adam Myers. He's a cardiovascular physiologist who's currently in Hawaii, so not with us today. But anyway, happy to talk to you about anything, and also we'll have time for questions at the end. But if you have questions during the session, please feel free to speak up. Dr. Golding.
That darn mute button. Hello, everyone. I am Lynette Golding. I use she, her pronouns. I am an adjunct professor for the HAPPY program, and for the past 5 years, I've been teaching the health communication course. I bring a wealth of expertise in transforming complex public health data into clear, culturally relevant, and actionable messages that I hope really, truly resonate with diverse communities. I have a deep commitment to health equity. It really drives my passion for ethical and evidence-based communication, and I have extensive experience in both academic research and practical global health projects. So I'm well equipped to bridge the gap between theory and real world application. Yeah, back over to you.
Jenny, what's next?
If you wanted to just talk a little bit about the rest of the faculty, there's two on the slide, and then we'll go to the rest of them that make up the program.
Oh, I can't see any slides. Oh, okay, I got it. Okay, sorry. Yeah, so Dr. Dutton is a cultural psychologist, and we have a summer or pre-fall program that's about a month long, where there is an anthropologist, a sociologist, and cultural psychologist who sort of do a social studies boot camp. So that's really what starts the program. And Dr. Sherman teaches nutrition, and you've already met Dr. Golding.
All right.
Pam Saunders teaches the qualitative part of our theory and methods of epidemiology. group of courses, set of 2 courses, and Dr. Marver teaches biology of health and disease, which not all of you will take. It's a requirement for people who don't have a background in biology if they haven't taken several biology courses. And actually, people really love that course. And then Dr. Turbat teaches health economics. Dr. Weinstein teaches what does she teach? I can't remember what she teaches.
I think it's some occasional kind of electives within the program.
Yeah, I don't remember the name of the course that she teaches, but they're electives. And Dr. Harvin is teaching the first part of our theory and methods of epidemiology course. He's just been with us this is the first year that he's been teaching with the program, and he's been getting rave reviews so far.
Yes, we're really happy to welcome him this year. All right, so I can talk a little bit about Georgetown in general and how our program kind of fits within it. At Georgetown, you engage with a community of students, faculty, and alumni from a range of insights, backgrounds, and experiences. This is something we especially value with the Happy degree because, as you'll kind of see as we go on, we give a lot of leniency for people in different kind of special topic areas of public health, people who are passionate about different issues within public health, kind of space to communicate and build off of each other within this degree. We have people who are interested in maternal health and racial justice and healthcare, in the treatment of rare and chronic diseases, and all sorts of kind of subjects in between there. So it's something we really value, both kind of within networking with other students taking other programs at Georgetown and within our own Happy program. Courses blend focused study and real world experience to empower your personal and professional growth. Again, this is something we really like to highlight with classes such as health advocacy, which sees you in a group project creating your own advocacy campaign for a health issue that your group is very interested in, kind of bringing more public awareness to. You have the opportunity to apply what you learn to become a leader in your community, and we are really rooted in Georgetown's Jesuit values, which prepare you to think, reflect, and act with intention. A lot of things you'll hear around campus are things like Cura Personalis, where we are interested in kind of the whole person, not just your physical well-being, your academic well-being, but also spiritual and mental there. We're interested in all kind of aspects of those, which I think really shapes our approach to public health as well. We want to make sure you're physically well, but also mentally well, spiritually well. You feel fulfilled and seen by the people who are taking care for you, and the system that's taking care of you. With that, I'll pass it off again to Dr. Fu Berman, as she is one of the founding directors of the program, to talk about the Happy program in general, what makes it different from kind of different Masters of Public Health programs out there, and why we kind of created this program some years ago.
Great, thanks. So we're really interdisciplinary, and what we really want to do is to train advocates for a better healthcare system, and not just people who apply the current system, but people who actually are actively trying to change the current system. And to that end, we not only oh, excuse me. We not only have an interdisciplinary set of courses, but some of them are unusual and not necessarily found in like a public health program, and that includes health advocacy, which is the course that I teach, in which students evaluate campaigns from health advocacy groups, and they do group and health advocacy projects. They attend meetings that might be the Food and Drug Administration. They might be congressional meetings. They might even be protest marches. So different sorts of advocacy events, and do group and individual advocacy efforts as well. So that's a really important course, but we really have this really beautifully curated group of courses at this point, and it's rather a small program. We usually have about 12 to 15 students in it, so they really get to know each other. Our current cohort's just a few weeks in, and they already seem very very bonded with each other, and I think Dr. Golding can talk more about health communications. We have this year-long program in epidemiology. The first part focuses on qualitative introduction, and the second on the first one's on quantitative introduction, and the second part's on qualitative introduction. So we're really, as a program, sort of focusing on non-medical aspects of policy and practice that affects public health.
Great, wonderful. Dr. Golding, would you be able to talk a little bit about health communication?
Absolutely, my pleasure too. So the health communication course is a required course in the HAPPY program. And the reason being is that health communication is central to addressing today's biggest public health challenges. And I would lump misinformation, trust in science, and health equity being some of those biggest, most wicked challenges. Health communication is important. It helps shape how people understand and interpret and act on health information. And in an age where misinformation spreads rapidly through social media and other digital platforms, effective health communication really helps counter the false narratives with accurate, clear, and accessible information. And it also plays a role in building trust in science, especially when messages are delivered transparently, respectfully, and through trusted messengers. Moreover, health communication really directly influences health equity by ensuring that information reaches and resonates with diverse populations, including those who are historically marginalized or face systematic barriers to care. Really without intentional, inclusive communication strategies, even the most well-funded health interventions can fail to reach the people that need them the most. So in short, health communication is not just a support function, it is a foundational tool for advancing public health. So my course is a practice-based, hands-on, really, course. It's not just theory, but application. In the course, we explore major health communication theories and their applications, because you need that foundation. But there's plenty of time to practice with an emphasis on designing, implementing, monitoring, and evaluating communication programs. This class is very participatory, which means that the students have to come to class having done the readings and understanding the topic so that they can do the in-class case studies and participate in the discussions and all that. I approach topics through an equity lens. You've heard me say equity a couple times in this introduction, but there is in this course particularly a strong focus on racial and social equity as it applies to health communication. And in closing, so, it's a hodgepodge of different things with this class. We work on a case study, tons of reading, lots of discussion time, in-class activities, and there's even student presentations. So that's a little bit about that. And Adrian, if you don't need me, I'm going to need to hop off.
Yeah, no, that's fine. Does anyone have any questions for Dr. Golding before she leaves?
No?
Okay, thank you so much, Lynette.
Thanks for joining us today.
You bet. My pleasure. I hope to see many of you soon. All right. Bye.
Bye.
All right, I will get into our program schedule breakdown as we go further through our overview here. First, here's kind of a general overview, what it looks like to be in the HAPPY program. It takes a year full-time to complete the program, just about 11 to 12 months. Enrollment is full-time typically, but if you are a part-time student, you'll finish in around 2 to 3 years. There is some flexibility kind of with your plan of study depending on your needs, and we've had a lot of students come through the program, balancing it with full-time work, internships, and other things like that. And that's something we're definitely able to work with, which is kind of the benefit of being a small program. We're able to kind of give that individual one-on-one advising to make sure your study plan works best for you. Another great thing that we have is our seminar series. We'll have a whole slide on this later, so you'll hear a lot about it, don't worry. But something really exciting about the capstone that kind of makes it a bit of the kind of crowning jewel of the program is it is weekly presentations and discussions with public health leaders from a variety of fields, variety of different universities and institutions across the country and even outside. We just had one scholar come talk to us from New Zealand, which was really fantastic. And it's such a great opportunity for students to network with public health leaders. Students will moderate those sessions, and it's open to the public. So it's something you can learn more about attending at the end of this presentation. Finally, our total tuition rate is offered at a reduced rate compared to the Georgetown graduate school rate offered by most programs. It should be noted, is the current rate. We do not yet have the confirmed rate for the academic year 2026. However, it usually is increased by a maximum of 4%. So if you want to do that math for yourself, you're welcome to do so to best estimate your costs. But just so you have an idea of the current year, students are paying $20.98 per credit. Our program is a 30 credit course. It's broken into 21 core course credits, just about 6 elective credits, which usually translates to 2 3-credit classes, but you also have some flexibility there, say if you want to take multiple 2-credit electives, and a 3-credit capstone project, which can take the form of a research based program or an internship. So here is the standard full-time schedule for the program. You will start in August of 2025 and complete the program in August of 2026 for students this year. So you guys would start 2026. The fall pre-session is near the beginning of August, and that's a sort of 3-week boot camp where it is taught by 3 different professors within the program. And they all kind of introduce a different perspective on public health and approaches to public health that will really serve you throughout your time in the program. So for this reason, we do ask that all students start with that same health, disease, and society course. Then you'll take a full schedule in the fall and the spring in person on Georgetown's lovely Maine Hilltop campus. You'll take Theory Methods 1, Biology of Health and Disease, Health Advocacy, Seminar, and your first elective. Although again, as Dr. Fuberman alluded to, if you have undergraduate experience in biology, you may be exempted from Biology of Health and Disease, which will allow you to take an additional elective. In the spring, you'll take Theory and Methods 2, Health Economics, Health Communication with Dr. Lynette Golding, your seminar course, and your second elective. And you'll conclude the following summer with a capstone or internship project. So part-time, it looks generally the same. You'll just take some less courses as you go, but you will still start with Health, Disease, and Society. Typically, students will take about 3 courses per semester when they're pursuing the program part-time. And then see, this student generally finishes in 2 years. It's just that the summer happens to fall after the spring, which is why it looks like it's 3 years here. I do have a raised hand. Amber, you can feel free to come off of mute if you have a question about the schedule.
Hi, yes. So just 2 quick questions. So one of them was about the biology. So I just want to know like what the extent of like having experience in biology means. So does this mean like just taking like a biology 1 and 2 or like someone who has like an undergraduate degree in biology?
No, taking a couple of courses is usually enough to be able to opt out of the course if you want to. It's just we get some English majors and psych majors who may not have taken any biology. We want to make sure that everyone can discuss common diseases like diabetes and heart attacks and things like that. So some people who've taken biology, opt to take the course, but if you've taken a couple of courses in biology, you don't have to.
Okay, great. Thank you.
Mhm.
And then my last question was for the fall, not for the fall pre-session, just the regular fall. When did you say that that starts?
You usually about somewhere between August 23rd and August 27th, depending on the year. So usually, and then the pre-fall course starts about 3.5 or 4 weeks before that. So there's usually like a few days off. And by the way, the biology of health and disease, I'm sorry, the 3.5 week summer course is virtual. So
Mhm.
people don't have to move to DC until the actual fall semester starts at the end of August. So it is in person. There's not an online option for the whole program, but the summer course is online. So people can be anywhere to take that.
Okay, great. Thank you so much.
Mhm.
Great, of course. Yes, as Dr. Fuberman mentioned, the Health Disease and Society course is via Zoom. People have some more time to get into DC. The fall and spring are traditional in-person semesters, and those follow the main campus university calendar, if that's something you want to look up via the Georgetown website. All right, so let's talk a little bit about electives. As a small program, we actually don't offer internal electives. What we actually do is we kind of have agreements with different departments across the university and different schools, which means that you are welcome to um, take a spot in electives in different programs, such as the Graduate School of Arts and Sciences, the College of Arts and Sciences, the School of Health, School of Public Policy, Georgetown Law Center, the Nursing Center. So there's a lot of things open to you. Generally, classes that just say that they're open to graduates and don't have any other significant restrictions are up for grabs. And we also have a pre-approved list of electives from the program directors that kind of give you more information on what students have taken in the past and what's available. So that's also a great resource we'll give to you to get you started. So because of that, you're able to kind of try out a lot of different areas, topics, things you're passionate about. For example, we have a good amount of students who are really interested in law this year, who applied for law electives. And we have some students who are interested in pursuing clinical careers after, so maybe they'll go to the School of Nursing and see what it's like to take one of those courses. Other electives that students have taken in the past include environmental health and policy, minority health and health disparities, health policy and politics, public health law and ethics, sexuality law and policy, and more, including a elective actually taught by Dr. Fuberman, which is medicinal plants and pharmacognosy, and that is through the pharmacology department, I believe, at the Med Center.
Yeah, so I didn't say this, but I direct two projects here. One is Farmed Out, which does research and education on how the pharmaceutical industry manipulates prescribing practices of physicians and other healthcare providers. And the other one is Urban Herbs, which is an ecologic gardening project. And so I teach a course in medicinal plants, but I also take care of 5,000 square feet of gardens on Georgetown's campus. And so it seems to be more undergrads and people in other departments who are interested in that sort of thing. But if you're at all interested in gardening, uh, that's also an option.
Yeah, and also our students will regularly intern for the Farmed Out initiative, and you're interested in kind of pharmaceutical ethics and marketing tactics. We just had a student, Noah, intern with us over the summer while she was starting out the program, so it's been great to see her around campus. Peter, you had a question?
Yeah, hey, so I know you mentioned earlier on like the last slide something about the classes taking place on the Georgetown campus. Is that for just like the fall semester and then the next semester is in the public policy school? Or like where do the
No,
classes?
we're mainly on the main and medical campus. We kind of joke that the main and medical campus are next door to each other, so it's all adjacent. And that's where most of the classes are. Some of the electives, however, may be on another campus. So the law school electives are on the law school campus. There, we have a new Capitol campus. There might be some classes there. So electives will be in other places, but all of the required courses will be on the main campus or medical campus, which is adjacent.
Okay, thank you so much. I appreciate it.
Hey, of course. Right, and I'll pass it off to Dr. Fu Berman to talk a little bit about capstone projects in the program.
Okay, great. So yeah, I mean, I think there's two aspects. Jenny's already mentioned seminar, and we'll talk a little bit more about that, which we love. But another great, well, there's a couple great aspects. One, I mean, one is also because there are more electives in this program than there would be in a public health program, for example, is people can actually put together courses in a particular area of interest. So we've had some students who are particularly interested in women's reproductive health or global infectious diseases or something, and you can put together your electives to reflect that. And then the capstone, which is usually done in the second summer, although there's some leeway in that. Some students have done it in the following fall. Some people have done it like part-time during the semester, but over a longer period of time. But it's the equivalent of 6 weeks of full time, so about 240 hours or so of either an internship, an independent research project, a non-independent research project. There's various things that people have done. So as Jenny mentioned, some people have done research with farmed out. Some people have done like benched research. Some people have gone to the federal government or DC government or nonprofits. And so these are just some examples. One of our students was at National Cancer Institute. Some students did things with nonprofit. Center for Medicare and Medicaid Services, of course, is federal. Some have done things at for-profit businesses, and that's fine too. So, and some students have gotten jobs from the internships where they were, but in any case, it can be really great experience. And we help place students. You know, sometimes students find their own internships, which is great, but we also have lots of we have lots of contacts, and we know people in a lot of different areas, so nobody goes unplaced. And seminar, which is really, I don't know, it's kind of our favorite thing. So Dr. Myers has been running seminar for several years, and every week during the school year, during both semesters, this is a Zoom class, which has been really great. We used to be live, and then during COVID, we started to do it by Zoom, and then we realized, wow, you know, if we do seminar by Zoom, we can bring people in from different parts of the country, or even as Jenny mentioned, our last speaker is from New Zealand, and she was actually doing the seminar in the middle of the night for her. But you know, we can bring people in from all over, and so we've had amazing people speak at seminar, and the students are the ones who do the introductions and do moderating, and it's, you know, it's a great experience. It's a great way to meet other people. But you don't even have to wait to be in the program to participate in seminar, because they're actually open to the public. And so you can come to next week's seminar if you want. You can come to the rest of the semester's seminars if you want. And it actually, you know, it might be a good way of kind of you can meet our current students and sort of see what we do. So the list of Jenny's put in the chat, like the list of current seminars, but we've had Dr. Fauci speak to us. We've had Gary Schweitzer is a journalist. We've had journalists and lawyers and doctors and public policy people and health economists and all kinds of people speak in this series. And we even have sort of a loyal group of outside people not in the Happy program who come every week, even some people from other countries. So that's pretty fun.
Yeah, we also do really encourage our students to network with speakers and see kind of what they're doing in their field, especially if they're interested in the job the speaker has. It's a great way to get a sense of kind of what public health careers are out there. And sometimes students will even take on internships with people who have spoken. For example, Kenda Sutton L of Birth and Color, which is a program in Virginia that I believe trains Black women to be doulas. She has taken on a number of interns from the program and she always loves having them. She says it's a great crowd. So that's always good to hear.
And some of the things, so our students go on, I mean, all of our students are interested in health. And often students, I feel like a lot of times students, when they start our program, they're not really sure exactly what they want to do, but they get solidified in what they want to do during the program because they meet so many people in different fields and they really get attracted to one or the other. So some of our students go on to further schooling. We've had students go on to medical school, law school, one even went on to social work school. Some students have gone on to PhD programs. But I think we figured, Jenny, that the majority of our group did go on into the workforce. So some have gone to work for government, some have gone to work for nonprofits, some have gone to work for local government, some have gone to work for industry. So these are some of the places that our students have gotten jobs after the program's over.
Yeah, absolutely. Because people are really kind of excited about different areas of public health, there's a lot of options with this degree. And since the program directors are very closely tied to the program, as am I, we're here to help get you there too. That's something we've been talking with students about as we got started with classes, just asking them kind of like what they're interested in, where they want to go with the degree. So I will pivot now into our admissions overview. I'll talk a bit about kind of writing the perfect application for the program, what to expect, and funding for the Happy program. First of all, here is a handy application checklist. Feel free to take a screenshot or a picture if that's helpful for you, but all of this information should also be on the prospective student section of our website. First, you'll need to complete an application form, which is done via the traditional grad student portal, gradapply.georgetown.edu. You'll need to submit an application fee. However, this is waived before January 15th, the priority deadline for admission, which I'll talk about a little later. You will also need to submit a statement of purpose. This is about 500 words in which you'll discuss your academic journey, what brought you to apply for the program, and kind of your personal goals, what you hope to get out of the program and do with your Happy degree. Because we are, again, like a very mission-driven program, and we're a small group who really has time to parse through applications, we do strongly urge you to fill out the optional statement on personal background. This is around another 500 words, and it gives you an opportunity to expand on your personal background, your experiences, and how they contribute to your interest in the field. This is also a really great way to demonstrate that you'll be an active contributor in our community. As you see, we're very kind of hands-on in our advocacy, and we move a lot beyond the classroom in some of our classes. So anything from volunteer work to work at a job, academic work, research, personal experience, all of those are great ways to show why you care about public health and why you want to approach it in an interdisciplinary manner. Next up, we require a writing sample. This can be as little as just a handful of pages, and this is really used to assess your preparedness to write at the graduate level and perform critical analysis, which is a key component of Happy education. As such, it does not need to be tailored to the application. You do not need to write something about a very specific health issue. Most commonly, students submit research papers or capstones from their undergraduate study. However, you're also welcome to submit op-eds, technical reports, and other such papers. If possible, for your three recommenders here, we'd like to have at least one of them be an academic you've worked with, such as a professor. However, if you've been out of school for a while and this isn't possible, we will accept one or all of your recommendations from responsible professionals you've worked with, such as somebody you've worked with in a position. This is managed again through the online portal, so you can enter the contact information in the email of your recommenders and they'll receive emailed instructions on how to complete their letter to you. A good thing to know about this requirement is we do not need your recommendation letters in hand when you submit it. So your recommenders should have a couple weeks of time to get their letters in. say you submit by the January 15th priority deadline, just their name and email, that will be considered submitted. You won't be charged a fee. You won't be considered late if you don't have the letter submitted in your application. We will also need a transcript with your undergraduate degree on it as soon as that's available, especially if you're currently completing that, because we just want to make sure, of course, the graduate school that you've completed your undergraduate study, you're ready to move on to graduate study. We will accept unofficial transcripts by both the priority and regular deadline for admission. However, we will need the official one eventually in order to make that final decision with the Office of Graduate Studies and just to confirm that everything looks good there. Finally, if you attended a school where English was not the primary language of instruction, you will need to provide demonstration of English language proficiency. You'll see on the right in that box there the minimum scores on the two types of tests we accept, the TOEFL and the IELTS test, to be considered eligible for admission. And you'll also see there that we do not require the GRE test. So, to talk a little bit about what it takes to be considered eligible for admission to the program. First of all, an applicant must hold a bachelor's degree or equivalent from an accredited institution. This should be a 4-year degree of undergraduate study in the United States or equivalent to that. You can use a credential evaluation system if you're an international student, such as the WES evaluation. If you are not sure if your study matches that requirement of a bachelor's degree in the United States. Again, this is a program that is really driven by kind of passion and our mission to improve healthcare for everyone. So we want to see demonstrated interest in your application. This can be for any public health related fields like healthcare, health equity, reform, and advocacy. All of that is strongly preferred. And feel free to use your personal background statement to kind of elaborate on anything you feel like is not already accurately represented in your application. Finally, the Office of Graduate Studies requires a minimum GPA of 3.0 on a 4.0 scale. With all of this in mind, I do want to draw your attention to that little box in the bottom right-hand corner because we're a small team and we're able to conduct a holistic review of applications. We do really want to get to know our applicants and what draws them from the program, and we acknowledge that not everyone has the same professional or academic journey. So if you are concerned about any of these eligibility requirements, but think you're otherwise a very compelling applicant for the program, we do encourage you to reach out to us via our email, happy@georgetown.edu, or to me directly, because in some cases we can make appeals to the graduate school for your admission. Next up, I'll talk a little bit about application deadlines. First off, that priority deadline grants you priority merit aid consideration. So that's one we highly recommend hitting, also because your application fee is waived. That is January 15th of 2026. We will continue after that period to review applications on a rolling basis until April 1st of 2026, and the application fee after that period is $90. Classes will begin for people who applied to both deadlines in August of 2026. August is counted sort of as a fall semester at the university, and our pre-fall session is billed with fall tuition, so make sure to apply for fall of 2026. Finally, I'll talk a little bit about financial aid at the university. It is rare for a program to be fully covered at the master's level by merit aid or other forms of aid alone, so we do recommend searching for additional sources of funding early. Everyone on this call is in great shape because a lot of those scholarship deadlines for the following year start happening in October. Some good resources to look at are ProFellow and Scholarships 360, as well as the Office of Graduate Studies webpage, which includes a specific page on external fellowships and scholarships, and more information about deadlines, tips on applying, and scholarships offered across Georgetown University. There are also resources within the Graduate Career Center and the Office of Student Financial Aid on seeking out kind of external aid to Georgetown. This program offers limited merit-based scholarships. Everyone is automatically considered. You don't need to submit anything else with your application. However, we do encourage you to apply earlier, such as by the priority deadline of January 15th, in order to get full consideration. That's just because we have more budget at the beginning of the year that we can offer to students. Um, Other things to look at are fellowships and scholarships. If you're eligible for Veterans Affairs benefits, you can contact GU Veteran Service for more information on starting that application process. The FAFSA, or free application for federal student aid, is indeed free and open for graduate students who live within the United States. So we do encourage you, if you're eligible there, to apply, because you could be found eligible for federal work study status or federal low interest student loans. So we always just recommend, since it's free, trying it out, seeing what happens. The good news is, even if you do not qualify for federal work study status, you are available to apply for jobs on campus. Students can work up to 20 hours a week while pursuing study full-time at Georgetown. This is handled through the GMS or Workday portal. You can start applying for positions as soon as you're enrolled and matriculated within the university. Typically, positions will offer for graduate students a good amount above DC minimum wage, which is $17.95. But DC minimum wage in the city is also pretty decent if you're searching for employment outside of Georgetown student positions. This can also be a good way, since this also includes teaching assistant and research assistant jobs, to get a sense of what other programs are doing, other ways to get involved in public health, or even just kind of adjacent fields to yours. For example, we are working with a student in a different graduate program to help us kind of create our digital content for the programs. Right. And finally, the Georgetown Office of Revenue and Receivables, which handles tuition and billing for the university, does offer monthly installment payment plans as opposed to the by-semester model through their office. You can sign up for that through the billing portal for Georgetown. We also do recommend, as you'll see in that box there, to reach out to your employer if you're planning on continuing your employment while working within the program, to see if they have any employer tuition benefits. All right, so thank you again for joining us today. We're excited to turn it over to you now for any questions you may have. If you have a question, feel free to go off of mute, use the raise hand function, or type in the chat, and we'll be happy to chat with you.
I have a question. So for the pre-fall session, so like if I'm trying to do the part-time class schedule and while I'm working full-time, like how does that work? Like is it like a night class, or I know you said it's on Zoom, slash like do you know like
Yeah.
how many days a week it would be?
So it's Monday through Thursdays, and it's the class itself is it, Jenny? It's like 12 to 4, something like that. But there's also a
Yes.
lot of homework every night and over the weekend. So for people who, and we've had a number of people working full time taking the program, but what we advise them to do is to take a few weeks off of work when they're doing the summer course, because it's very intensive. So it's 4 hours of class a day plus homework every night. Like it really is a kind of a boot camp. There's not class on Fridays. There's not class in the morning. So we did have we've only ever had we've had sometimes people have worked out something where they're still working part-time while they're doing the course, but even that has been difficult but possible. We do not we only ever had one student work full-time while taking that course during those 3.5 weeks.
Yeah,
So
to clarify, that's for the Health, Disease, and Society course.
Yeah.
Students usually don't have as much of a problem working while pursuing the kind of fall and spring traditional semesters.
Yeah, for students who are working full time, we just advise them, take some vacation time during that 3.5 week course. But it's not a problem working full time with the other courses. We try and group the courses. Most of the courses are near the end of the day. The seminar is at noon, but it's also a lunch. It's like a lunchtime hour. So, it has not been a problem with students working full time, except for the summer course. And the summer course has to be taken first, even if you're part time. So that's our one sort of strict rule: is you can't take the summer course in the second year. You have to take it in the first year.
Okay, gotcha. Thank you. So it's only 12 to 4 for like 3.5 weeks, you said. Um, but then like when the normal classes start, you can find like night classes or like more like later afternoon classes.
Yeah,
Okay,
absolutely.
thank you.
Yes, and as she mentioned, there's no happy core classes on Fridays, which is nice. All right, thank you for that question. And Edwin, I see your question in the chat. The recording of this webinar will be shared out to participants afterwards once we're able to clean it up and upload it for you. Great. Are there any other questions about the program?
I guess I do have another question.
Yeah, feel free.
So for the summer capstone internship project, I'm just curious, like, um, is this like a placement into an already like existing project or research, or do you like come up with your own research project or initiative? And is it like a full-time internship? Again, it's like I'm just wondering because I would probably be working full-time, so.
hmm It can be part-time just over a longer period of time. It's a minimum of 240 hours. So some students have done something part-time over a couple of semesters, for example, or over the spring semester in the summer or whatever. So, we definitely are flexible about people who are working part-time and doing a capstone part-time. And the capstones sometimes it's working with somebody on an existing project. Sometimes students have done them independently, but if you do them independently, you still have to have a mentor supervising. And then I'm the capstone director, so I'm also sort of like keeping track of everybody and keeping in touch with with their supervisors and that sort of thing. But we'll help people get capstones. Sometimes they arrange them themselves and we have to approve them. But we've got lots of options.
All right, thank you.
Other questions?
I have a question. Can you hear me?
Mm-hmm.
Yeah.
So I wanna like, do you guys can we do specific like subtopics? Like specifically, I want to do epidemiology. So would I just take like specific classes, or like would it just be, oh, I'm getting like a master's of science in public health with like a concentration in like epidemiology? Because I saw on the website it says there's like a subtopic of infectious diseases. So I was just wondering how that works.
So we don't have any MPH programs here. We don't actually have a public health school at Georgetown. So the Happy program is kind of our version of a public health program, although really, it focuses more on advocacy. So the theory and methods of epidemiology course is a pretty basic course in epidemiology. If you wanted to do more in epidemiology, there are more advanced courses. We have a small department of epi at Georgetown, for example. And so there are electives there that sometimes there are other epi courses that students can take. We just try and make sure that there's not too repetitious for the one that we do. The one that we do is pretty basic, and it's not just epi. It also includes information on ethics and other aspects of epi. But yeah, you can focus on epi. If epi is you're the major thing you want to do, it would probably be better to go to a school that has a real public health school with an MPH. Yeah. So that's what I would advise if that's your main interest.
Thank you. Appreciate it.
Mhm. Other questions?
I know I could probably like I'm planning on like going to like the TAP office to like talk more about it, but are you just curious, like are you eligible for merit aid at all while also using like the TAP benefits if I'm a full-time employee at Georgetown?
That's a good question. I do think, to my knowledge, Georgetown's trying to phase out the use of those at the same time because TAP is such a significant benefit. So I think that would depend on the TAP office, but I'm pretty sure that they do not want you using the both at the same time. And honestly, the TAP benefit would be a much better deal than Merit Aid because it's a 90% reduction, which is really generous.
Sure. Okay, I'm just curious. Thank you.
Yeah, no problem. Okay, any last questions?
If anyone thinks of any questions, please feel free to email either of us. Always happy to talk to students.
Yeah, I'll put up kind of our contact slide here, but as I'm closing us out, don't hesitate to keep typing questions, things like that, if you have them while I'm talking. But it was really lovely to see all of you today and welcome. We are really excited to hear more about you and how you'll hopefully contribute to our program in the future cohorts. My contact card's up there and the program phone number if you'd like to get in touch with us that way. You can schedule virtual office hours with me via my email signature. You can reach out to our program email as well, which is HAPI or happy@georgetown.edu. I also recommend keeping in touch with our social media, our Instagram and our LinkedIn, because we post program updates, student and faculty publications, and we also post about our weekly seminar series, which is a great way to get a peek directly into what a happy class looks like. That one is a little bit different than a kind of traditional lecture course, of course, because it's more based on a speaker coming in every week and it's less of like class discussion. However, it is a great chance to kind of see our students, how they're moderating the programs, the types of people and perspectives we're bringing in that they're learning about. And that's completely open and free for you to attend every Wednesday afternoon on Zoom in the fall and spring semesters. So definitely follow those for more updates. I'll check the chat one more time in case I missed anything. But, all right, so everyone have a great rest of your day. Thank you very much for joining us today, and we hope to see you soon. We wish you the best of luck with your graduate applications.
Yes, thank you so much. Best of luck, everyone.